Well, welcome everyone. My name is Rob Cashel. I'm the president and CEO here at Family and Children's Agency. And again, I want to welcome you to another virtual conversation. And we've been doing these over the last year and a half or so. Today's topic, I think, is hopefully a very interesting one to our audience. And of course, it focuses on the issues of homelessness in our community and what will be some real creative thinking on the part of a very distinguished panel on how we can change the trajectory of the issue of homelessness in our community. I'm going to turn over to our panel with some questions in just a couple minutes, but first let me tell you who is with us today. First, David Rich, who is the founding president and CEO of the Housing Collective, where he has played a leadership role in developing and implementing solutions around how homeless services at the local, regional, and state level. David is well known not only in Connecticut, but nationally, and has served on a variety of leadership roles in our state and in our nation around this important issue. David holds a Bachelor of Arts in Political Science from Yale University, a Master of Science in Urban Studies from Southern Connecticut University, and also a Master of Management from the Kellogg School at Northwestern University. David was also our 2022 Family Strengthening Award honoree here at FCA. And David, it's great to have you with us today.
Great to be here, Bob.
We also have Adam Bolvinsky, and Adam is the executive director of the Norwalk Housing Authority, which works with over 2,000 low-income families through providing public housing and Section 8 vouchers. Adam is also a leader in the field of dealing with housing and particularly around the issues of homelessness. And we are delighted to have him. His background includes a degree from Yale University with a BA and then a law degree from Boston College. So welcome, Adam. It's great to have you with us.
Thank you, Rob.
And also from FCA today, we have Chris Giacchino, who is a senior director here at FCA, overseeing our community connections programs, which involve all of the services we provide to the homeless. Chris has been with the agency for over 20 years, also a leader in this field, and serves on a variety of local, county, and even statewide bodies that address the issues of homelessness. Chris has a master's degree in social work from Fordham University and is a licensed clinical social worker. Welcome, Chris.
Thank you, Rob.
And then finally, our panel is filled out by another member of the FCA staff, Lorraine Reed James, who is manager of youth initiatives, particularly focused around issues of homelessness here at FCA. Lorraine has been on staff for over 11 years and has worked in a variety of different programs, and now is focused in our area of homelessness with a particular focus on young people who are dealing with the homelessness issue. Lorraine has a bachelor's degree in political science and a master's degree in sociology, both from Southern Connecticut State University. So welcome, Lorraine. It's great to have you.
Thank you,
part
Robert.
of today's panel
this afternoon.
So we're going to jump right into this and respect people's time. That we have some questions, and of course we always welcome questions for people who are zooming in, and we will collect as many of those questions and then hopefully have our panel answer them. But to get us started, let's ask some broad questions. And the first question I'm going to ask you first, David, which is, what is the current homelessness situation here in Fairfield County?
Fairfield County in the last year, which is 2022, the calendar year, there were 2,230 homeless throughout the year, and that doesn't mean they were homeless for the whole year. At any given time, there's less than that, but those who cycle in and we hopefully get them out, or they find they resolve themselves, is a little over 2,000. When I want to stress here that it is a lot to begin with, but it's the first time in 8 years that the number has increased. And we had a noticeable trend for 8 straight years of decreases, and largely because of the efficiencies and the strengths of our entire system. But we're facing some severe headwinds now, and the number went up around 8-10% in the last year. And later I'll get into some other numbers that really I think hopefully emphasize the stress points that we have in our system at the moment.
And David or anyone, how does, putting some context there, how does that look on the state level and even countrywide? What's happening in the real big picture?
I'll start with that and then see if anyone wants to add. Statewide, it's roughly and any given year, it's 8 to 10,000 that become homeless sometime within that year. We usually average 20, 23, 24%, somewhere in that range of the entire state. The state also had an increase. I think it was around 12% last year, and on a national level, around 600,000. Or a little shy of 600,000 homeless, and that's been pretty steady for 20 years or since they really started measuring this. But I think it's also important to note that on our country been for this is new of our generation and maybe a little of the previous generation, the last 30 or 40. It's not inevitable. It's not something that we need to live with. This is something that we as a country before and are we really strive how we can really end this plight.
Okay. Thank you. Chris, maybe you can comment a little bit on what's happening here in Norwalk.
Sure. So I think that's really helpful in David giving some kind of Connecticut numbers and then some national ones as well. I think it's helpful to share with everybody, what the current numbers are, but how we get those numbers, and just so that kind of gives a picture to the landscape of homelessness in Connecticut and, I guess specifically more Fairfield County. So there's a couple of different exercises or platforms that we use to for our data. So the first one, and people might be familiar with it, it's called a point in time count. It's called a PIT, is the acronym. It's an annual 1-day unduplicated count of the sheltered and unsheltered homeless individuals and families across the United States. And in Connecticut, we just did ours. Excuse me, we just did ours in the winter, in January. We're waiting for this year's point in time numbers to come out for the 2023. So if you're looking at last year's numbers, as David referenced, we're around 20, well, I should say the point in time count is important because it's a snapshot. It's kind of a one, I'm going to say a 1-day snapshot, but when you're dealing with all these communities, it does take a couple of days to kind of put all that information together. But the point in time count came basically across this 2,900 people in Connecticut were literally homeless. And when you look at Fairfield County, there were 646. So a little bit more in the detail of those numbers. Of the 646 in Fairfield County, 45 of those were youth. 408 were individuals, and then 193 families. Now, again, this is just a snapshot. That's not the whole year. That's just on that given day in Connecticut, 2023. That's what our numbers look like. And why this PIT is so important is this is what Congress uses as a measure to decide what resources, what funding is going to be kind of distributed out across the country. So that's a snapshot. And then another important kind of platform that we use is called a by name list. The by name list is our actual numbers, and it's really a registry of people who are experiencing homelessness, and it's by name. And we do this by name list weekly. So when I looked at the numbers for this week, they were published on the 7th, so 2 days ago. And in the state, we were looking at 674 families in Connecticut, and in Fairfield County, 177 families. We had 157 youth, and 48 of those were in Fairfield County. And then we had 2,456 in Connecticut and 370 individuals in Fairfield County. So when we look at the numbers, we're looking at the state, but then we're also looking at Fairfield County. The by name list is basically our active registry of people that are experiencing homelessness in Connecticut. So that's our real-time data. So when we're looking at a snapshot when we do point in time, and then we're looking at a by name list for the real-time data. And I just want to kind of have to really thank whether it's Fairfield County or the state for all the partners, because this is these exercises or activities that we do in the database that we use is so important, because you need to have all the providers entering data into the system to really get an accurate reflection of how many people are homeless, because then we use that data to really create the system, the homeless response system. But you can't do that unless you have accurate data, and that's what we have. And then the last kind of piece is all the homeless service providers have to enter data into what we call a homeless management information system. And that's where we collect the demographics. That's where we have the housing status. We have the service history. And this is all the homeless service providers funded through HUD. But what we also try and do is reach out to those agencies or organizations or groups that aren't HUD funded to also put data into the system. So again, we have one system that captures all of the client information in the state of Connecticut. So all these platforms are important, because what it does and the result is Connecticut, and specifically Fairfield County, is one of the highest performing communities in the country. We have other communities look to Fairfield County and the state of Connecticut when they're designing their homeless response system. They're looking to us. We are a leader in the country, but even a leader being in the country, that we do face a lot of serious challenges, which is across the country at this point. So just wanted to give a little context on the data systems that we use to engage people in our services.
Great. Well, thank you, Chris. And you made reference to our housing authority and its high performance. And Adam, I wonder if you might want to comment. You've been involved in developing lots of ways to create affordable housing. That's, I know, been a big focus. What do you see happening in Norwalk from your vantage point?
Yeah, if we're looking at the challenges that we face here in Norwalk, it's a very, very expensive jurisdiction to live in. The National Low Income Housing Coalition does their annual report, and they determined that you need to earn $89,000 a year to afford a 2-bedroom in the Norwalk Stamford metro area. That's 3.1 full-time minimum wage jobs with the current $14 an hour rate. So if you don't have some sort of a subsidy, or if you don't have a college degree, it's very difficult to break into the market. And the Public Housing Authority, well, almost all of our wait lists are closed. You can't even get on a wait list and then wait for a couple of years for housing. So that's often not an option. We do have some special vouchers, 110 mainstream vouchers that predominantly go to the homeless. But those get snapped up quick. They're all being utilized, and that can be very difficult. And finally, even if you have a voucher, it can be very difficult to break into the market, because landlords still do background checks. They want to see if you've been evicted. They want to see if you have any convictions, which many of our homeless may have in their backgrounds, or they don't have credit, or they don't have enough credit, and that can be a challenge. And even when you do find a landlord, well, to access the voucher, you need to have documentation, and that can be difficult for our homeless populations, as well as getting and keeping documentation while you are homeless. can be very difficult to do. So one of the things that the Housing Authority is trying to do is work as closely with all of our partners as possible. In each new development that we create, we're setting aside a certain number of units for the homeless system to give us the names that can come directly from their list. And we try to create as many flexible systems as we can so that when somebody comes to us, if they don't initially pass a credit check or a background check, we can do an individualized assessment and make exceptions wherever possible to make sure that folks can get housed and become stably housed. But it's really about an alignment of our interests with that of the homeless system and making sure that we all agree that we're headed in the same direction and pull together. So not fighting over resources, but making sure that we are as amenable to everyone as we can and open up our resources to the homeless system.
Great. So I have a question for the entire panel. Sometimes it's confusing to people. Who are the homeless? So who are we talking about when we talk about, just use that term rather loosely? What groups, what populations, what are we talking about?
Well, I think I'd first start off, it is people that are literally street homeless, that have struggled with mental health and substance abuse. And that's kind of traditionally been, unfortunately, the stereotype. But we're all, with the current economic environment, we're working with individuals, we're working with families that, and Adam was talking about, the cost of rents and so forth. Families that are not earning enough income that they can pay the extreme rents that are in Fairfield County. And so the landlord that they were paying is reading the tea leaves that they can charge $300, $400, $500 more a month. And when that lease is up, that landlord is going to, realize that the fair market rent that they can get is more than it was before. And so that family now has to leave their unit. And that's kind of where our system hopefully comes into play that can provide some supports. So it's the mental health, it's the substance abuse, it's the families that we're working with that are being priced out of rental units. Kind of what we've tried to do is set up a coordinated entry system or a coordinated access network so that we can meet the needs of all the people that come into our that are in need of housing assistance. So what we've tried to do with a collaboration, which is called Open Doors Fairfield County, is, in David's group, really the Housing Collective leads this charge of a collective impact approach, which coordinates strategies for prevention, housing, employment, advocacy, and services to ensure people who are experiencing homelessness that their episodes are rare, they're brief, and they're non-reoccurring. And the non-reoccurring is so important because we really want to provide a service that helps them so they don't enter back into the system, because we all know there are limited resources. So the brief and the non-reoccurring are such an important piece, and so that all citizens in Connecticut, Fairfield County, have access to safe and affordable housing. Now, the solutions to homelessness is this coordinated entry kind of CAN system. It has to be, streamlined for individuals and families that are experiencing this homelessness. It has to be standardized, it has to be comprehensive, and it has to be accessible. Now, I know that's very wordy, but those words are so important because when we're having these community conversations, we've really worked to create a formalized system, and a formalized system has to have all of those components. The CAN system has to be effective, it has to be efficient, it has to have those housing resources, it has to be able to target the funding opportunities when they come about. And when those housing funding when those housing opportunities come about, the system already has to kind of be in place to apply for those opportunities. And that's what I think we've been able to do. And I think one of the also kind of, I don't know if it's new important piece, but social work traditionally has been very, kind of warm and fuzzy, right? We're social workers, we want to help. But what we've learned and what we know is very effective is the coordinated system has to be data driven. Our decisions have to be made based on data. We have to have a decision-making culture that's in line with stakeholders. We need to know we need to make sure that everybody that is a service provider that touches the homeless population is at the table. And we have to have those community discussions. We have to identify the opportunities for improved service. Traditionally, agencies would get funding and we'd go out there and provide services. But that didn't mean that every service provider out there was operating services effectively. And I know Adam was at the table, David was at the table. When we had conversations regarding agencies and what are you providing, how effectively are you providing it, and is it cost effective? And those aren't easy conversations, but we had to have them, and we've done that, and we continue to do that. So, and I do want to mention the CAN system. There are 8 cans.
So Chris, before you do, and I think the CAN system and the work in coordination you all have had so much involvement in. So I think we do want to go deeper on that. I just want to make sure we're answering fully that question and around who are the homeless. And I'm wondering if there are groups, and I'm thinking of you, Lorraine, that we often don't think of as part of sort of this large homeless community. And I knowing some of what I've heard you do, there's some populations that we often don't think of as homeless. Can you talk a little bit about that?
Absolutely. I think Chris gave a snapshot of what sometimes we think of as the homeless, but there are pockets of groups that we will not think of. For example, minors who are experiencing homelessness and housing instability. Folks may not think of that population, or someone who is currently working. They might think, oh, you're currently employed and you have a job and you're going to a 9-to-5 every day. No way can you possibly experiencing homelessness. But also we have those folks that are currently in our community colleges that are experiencing homelessness and housing instability. And so with us at FCA, we have formed a partnership with these community colleges, specifically Norwalk Community College, as well as Housatonic Community College, that have recognized that there are students currently that are attending these institutions that are experiencing homelessness and housing instability. So they have identified pockets of money that they are utilizing to mitigate and kind of help and support these students while they're in the process of trying to achieve their own goals with their life, but then have this barrier that could be kind of on their shoulders to achieving those goals. So in this process, we've identified a case manager that is stationed within both institutions that meet with students and kind of talk about some of the issues that are presented. And we have helped them with first, last, and deposit, utilities, rearages if they're currently working and they're just not making enough income to support themselves and continue to pay their the rent. But we want to empower and not kind of enable. So we're also creating case management services. We're teaming and making referrals with these populations to ensure that they're being empowered, so that when we're no longer in the picture, or they're no longer attending these institutions, they can be standing on their own 2 feet to kind of not enter the homelessness system. So we've referred to different employment workforce agencies to help them, whether those are employed, underemployed, to improve, or just needed to improve their skills to be more marketable, resume building, things like that, to kind of help them along the way. But yes, these are populations or pockets and groups that folks may not think would be experiencing homelessness and housing instability.
So if someone were to ask, and you've all touched on it in various ways, but if someone were to ask, what are the main barriers for people securing permanent housing? What would you all say? David, we'll start with you.
Yeah, and I hear I can be coming through choppy, so Rob, cut me off if I'm unclear here, and I'll pivot. And I think I'm gonna certainly ask this from everyone. For me, there are a number of things that we worked on, but the most critical now, 1, 2, and 3 is housing. We don't have enough of it. It's too darn expensive. It's the most critical barrier, bar none, that's facing us now. We spent a decade building a very credible, as Chris said, wonderful system here. We've been able to bring in quite substantial resources, thanks to folks like Adam on the housing authorities and from the state and federal level, and resources there. We just can't find the housing right now, and I could go on for a long time, but I won't. Turn it over to others. But I don't think anything that has to be first, second, and third that we deal with or try to deal with head on. And it's complex.
Yeah. Other thoughts from other panelists around the challenge? I'm going to guess there's going to be a lot of common answers here.
I would echo what David just said, just the affordability as well as access. There's a lot of folks who are working that just can't afford rent. So and there's some units that just aren't available currently. We just don't have enough. So I would echo his sentiments as well.
Yeah.
Yeah, I would as well. David said it, units. And if you go online to look at 1-bedroom units in Norwalk, there's just so few available. So as David is always kind of the antagonist, is like, okay, if this is the problem, how are we going to fix it? And that's what we need to do, is really build relationships, but across a bunch of different areas. First is we need to do a better job of engaging landlords that have 1, 2, and 3. There's somebody that lives in Norwalk and they've got a couple rental units. We need to make sure we know I'm exaggerating a bit, but we need to know every single landlord in Norwalk that's got 1, 2, 3 units. Then we need to know small developers, but we also need to build relationships with the big developers. And actually yesterday, David, myself, Adam, and the Norwalk Housing First Collaborative met with a developer that Adam is working with. And he brought up the point. He's like, I live in Norwalk. This is where I live, and he's a developer, and his company, has been around. I think he said 6 years. So we need to be looking at all options for identifying the current inventory, but then also building relationships with new providers or new developers. Excuse me.
Adam, anything you want to add to this question around the barriers, or are you pretty much in line with everybody else?
Yeah, no, and I think I touched on some of this before. The cost of housing here generally is just a huge problem. Our wait lists are generally closed. Our 1-bedroom wait list, they're talking about 1 bedroom. I think it's been closed since 2014. It's still years long. Our policy now is that if a wait list is more than 2 years long, we keep it closed, because it's administratively burdensome to try to find somebody on a list that's been around for 7, 8 years. They've moved on. They don't respond to us, so the unit will stay vacant while we're asking one after the next person on our list. So our wait lists are closed. The vouchers are mostly taken up. So finding the units is difficult. But I do think that to pivot a little, we understand this problem. We're trying to work towards the solution. The Housing Authority has recently created both a landlord incentive program where we're willing to pay a little bit more in certain neighborhoods, where we'll pay for a month in between Section 8 tenants, so that the bureaucracy that can slow down the system, that the landlord doesn't lose out and they're more willing to participate. And there's also a myth that some of our Section 8 tenants are destroying units, but to meet the needs of that myth, to try to convince landlords to participate anyways, the Housing Authority is creating a program where, above and beyond the 2 months of security that the tenants have, we'll pay for damages to any unit for an additional 2 months. Do we expect to expend a lot of money? No, because honestly, our tenants are not generally destroying units, but by being able to say that, we might attract more landlords. So we're really trying to find a way to engage landlords, get them interested in the system, let them learn how it works, why Section 8 is such a wonderful program for them to participate in, almost like a guaranteed rent. No other tenant, when they lose their job, can pay their rent, but ours can. The homeless system that has the vouchers can. So it's really about trying to meet the landlords where they're at, engage them, and in a collaboration between the Opening Doors of Fairfield County, FCA, and the Housing Authority. We've also hired a staff person to full-time work on engaging landlords and finding places for the tenants who have those vouchers, because it's become just so challenging these days.
Yeah.
I can just put an exclamation point on that. The vacancy rate, the tightness of this market is consistently in the top 2 or 3 counties or regions in the nation. The cost of housing in the top 1 to 2%. So this is not something, oh, it's just it's hard. It's really tough here, and it's gotten even tougher over the last several years of COVID for a number of reasons. I'm just going back to a point of Chris's too, and Adam. So we're actively engaging landlords is critical. As critical is preserving those relationships with the landlords. So making sure that we're providing the services that if there is a crisis, which invariably there are going to be some that are folks in crisis, that we're there, that we mitigate it, we resolve it. As Adam says, that we have the funding, we give the support, so that we're really, people don't like me saying this, but it is putting the landlords almost on a pedestal here. We need them. And we have to see them as a real partner for us for years to come. Bob, you might get here. I just want to pivot or put where, but no matter what we do with landlords, and this is something where sort of I've gone through some of the sort of more of like an existential crisis in my work. I've been building the system or helping to build it with everyone here for the last 15 years, and beginning to think that, is it almost all for naught? If, for example, you only have 8 units and you have 10 families struggling to get those 10 units, no matter what you do with the system, how well you do it, and how many resources you can make this problem worse. By putting more resources in for a few of those families, it's going to drive up the price for anyone else, unless we're able to create more a permanent affordable housing rental in Fairfield County. We're not going to be able to get ourselves out of this issue, and that's fundamental there. And that raises some really tricky, thorny issues. We say, oh, it's the market or the economy. No, it's us. It's us, our communities. We're the ones who thwart this. We're the ones who create the most segregated, or one of the top 2 or 3 segregated counties in the nation, because of our collective work in our communities here, in the local control that systematically thwarts, stops, opposes the amount of housing we need. And that's very hard to change, but we've got to really look ourselves in our eyes, our hearts, and say we fundamentally have to change this narrative.
So you're all stimulating a number of questions from the people who are Zooming in. And I think you've answered this to a fair degree, but I'll pose it because it came in from one of the audience. And that is when, I think you were the one, Adam, who made particular reference to the waiting lists, but any of you can answer. Is it a money issue, or is it a housing availability issue? So I kind of know it's the answer, but I'll let you comment.
Yeah, it's certainly both, right? There's only so many public housing units in Norwalk. We have a little over 1,000 public housing units. They're all full. It's not like we have vacancies. The vacancy only lasts as long as it takes my guys to go in and paint the unit. So as far as public housing goes, it's a matter of brick and mortar, how many we have. The vouchers it's an issue of money, and it's predominantly money coming from the federal government. So if the federal government offers more vouchers, we apply every time. We do everything we can to get those resources here to Norwalk. But the more vouchers we have, we still need places for them to go. We still need landlords willing to accept those units. And with this, influx of people coming to the Fairfield County area during the pandemic, landlords have learned that they can be very picky and very choosy as to who they want to take, and that often leaves our clients out of the equation. We've done very well. The data shows that our vouchers are getting leased up. We're not leaving resources on the table, but it's definitely getting harder and harder for the staff of all of our agencies lease them up. We're giving more and more extensions for homeless or any Section 8 tenant to find housing, because it's becoming so hard out there. So it's really both. We could use more vouchers. We could always take more vouchers for the homeless population. But if we don't find more landlords, it won't help the situation.
Right. So a while ago, Lorraine, you were talking about specific groups that we may not think of in this population struggling with potential homelessness or homelessness. Question came in from our audience, if you will, around, are there particular resources for particularly certain high-risk groups, victims of violence, sexual assault, seniors? And then there was another question around security deposits, but maybe we start with, are there particular areas of resources for people who come from particularly high-risk groups? And certainly seniors is in that category as well.
Absolutely. So we're looking at being strategic and looking at resources that target certain populations. In particular, our work with the youth, we are looking at those who are unaccompanied and minors who folks don't really necessarily look at as being homeless. So what we have created is a pilot program that we have started in Stanford, Norwalk, and have pilot also in Bridgeport, but covers all of Fairfield County, and not just us here at FCA, but other pockets of the state is looking at that as well, is creating what we have created, a community care team, which is composed of different providers in the space that provide services and supports to this pocket of population. And so we all come to the table, we get a referral, we case conference this particular referral based around the needs that have been identified during the intake. And it's a great opportunity for providers all to be at one seat doing our work as we have done. And it's a collective impact model that we have created. So those who are vulnerable, we're eliminating those barriers to services because we're all at the table at once and discussing how we can best support this particular referral. And then the referral person now has the opportunity to meet with the community providers, and it's a one-stop shop, right? You don't have to go here and there and everywhere to kind of seek out those services. They're coming to you in a group setting, and they discuss how they can help support you. So there is a lot of partners within our support community care team that we've created, and they've provided services to minors as well as young people that are experiencing homelessness and housing instability. As far as seniors, I know that within our group, the senior services are mitigating that as well. And we have a case manager that is assigned to really look at that and provide different services and supports to that population.
Yeah. So that's a nice segue to something that I think, Chris, you were beginning to get into as you were, David. And that is, what are some of the solutions? Because we've been talking a lot about barriers, housing, affordability, the kind of, community we're in that's very, very affluent, and the challenges around housing for people who really need it. But there's some real positive things happening as well. And I know there is some unique things happening in Fairfield County, Open Doors Fairfield County, and then the backbone of that, David, of course, is your operation, Housing Collective. So I wonder if, and I'll just throw this out, maybe starting with you, David, and we'll go to you then, Chris, too, Adam and Lorraine. Tell the audience a little bit about what this Open Door Fairfield County, with the backbone of Housing Collective, what is it? What is it all about?
Yeah, I'll start with that, but I'm going to turn it over to Chris really quickly. And this is, I might be embarrassing some of you here on FCA because this was unsolicited, but I do want to give a real plug to FCA on 3 different levels. I think for us to really do this work well, it's at the system level, which we'll talk about, and I think where your question is at the agency level. That's really critical here. And it's also at the community level. And I just want to get hats off to FCA. This wouldn't work without agencies like FCA around. Through Chris and various others on your staff being integrally involved with our collective work or system work. Chris was talking about New York Housing First. FCA, the founding member of their being in the leadership of the Open Doors Fairfield County for since our inception, even before that, for the last 10 or 15 years. It's critical to have agencies like FCA with really key leaders investing, because this is collective impact. It only works if every agency or those key agencies are involved actively and really believe and in the ethos and the culture and the organizational needs of collective impact. So hats off to FC on that. More and more we struggle with is that really what I call the final mile. If you don't have effective folks at the working at the front line, then it's ineffectual our work. And that's again where FCA is really strong on that. And thankfully, I wish we had all agencies that had the professionalism, the folks like and even those supervisors like Lorraine that really make the impact work. If you don't have that, no matter what your system is or resources, it's not going to work. And lastly, which is on the community level, we've got to keep extending outside of our agencies, outside of our homeless networks, if we're really going to solve this problem in multiple different areas. We've talked about the housing area and how we really have to change the whole narrative of how we look at affordable housing and not seeing it as this huge fight between the elite and the gated communities and the rest of us. And how do we change the conversation so everyone sees this as something that that is beneficial to all. But let me turn it over to Chris to really talk about more of the details of the systems, which you were so actively, FCA is so actively involved in, and help nurture and grow over the years.
Sure. Thanks, David. Yeah, I do think it's important because when we have these conversations, you know, the ultimate question is, well, what are you really doing? How are you actually really helping people that are homeless? So I'll put a reference, kind of what I said before, is social workers are warm and fuzzy, right? We just want to help people, but you really actually have to have a model. You have to adhere to a model of evidence-based practice that shows what you're doing is really working. So kind of and this started years ago out in Oregon. It was called a housing first model. It's basically evidence-based. It's founded on the principle that individuals or households' first and primary need is to have stable housing. And that's what we need to do. We need to get them into housing as quickly as possible without any preconditions. The old model used to be, let's stabilize people and then we can get them into housing. We realized that didn't work. So what we really do is we need to get people into housing, and then we start to address the income, the job skills, sobriety, and getting them into treatment. So housing first model is what all the providers follow. And then we really have 3 interventions. Now, I know this sounds like we're getting into some of the weeds, but it's really important, I think, for everybody to know what's the actual work that we do with the families or the individuals when they are literally homeless. So first thing we do, it's called rapid exits. It's a quick influx of cash. And in social work, we're always talking about services, but services are important, but sometimes a family just needs money. Okay. And that's what the rapid exit is. It's a quick influx of cash. Here's security deposit, first month's rent, maybe 2 months of rent, and it gets them off the street or out of a shelter and into an apartment. So that's rapid exits. And hopefully that's what we would like to do the majority of the time. Someone is literally homeless. We give them this quick influx of money, and then they go into an apartment, and then they don't use any more resources of the system. They don't enter back into the system either. So that's kind of the first intervention. And then the next one is what we call rapid rehousing. Which is moving people who are experiencing homelessness into permanent housing as quickly as we possibly can, and providing short-term financial assistance. And the financial assistance can be helping them pay utilities, but also really rental assistance. And that rapid rehousing is important because, again, it's working with people that are literally homeless, getting them into housing, and then providing that short-term rental assistance. And at first, we may provide, first couple months, we may provide 100% of the rental assistance. But the longer they're in the program, we start to roll back the rental assistance and that earned income takes over. So that's kind of the second intervention that we use. And then the third is called supportive housing. And that's really a lot of what FCA does in Fairfield County. We have over at any given time 125 units of supportive housing. And this is kind of the longer term rental assistance. It's not time limited like rapid rehousing is, where we'd roll it back. The supportive housing is basically a wraparound support services to the family or individual. These are usually for families that have higher needs. We provide that case management and support services so they don't cycle back into homelessness, but we're really also helping with the monthly rent. And that's important because a lot of people who are in Fairfield County can need the support services, but just can't sustain the monthly rent. If you're looking at a 1-bedroom in Norwalk, you could be looking up to $2,000 a month in rent. And then you have utilities on top of that. So all that, you put all that together, the supportive housing piece that FCA does is such an important piece to working towards ending homelessness in Fairfield County and also in Norwalk. And I know that kind of sounds, the homeless response system we have is very intricate, but as I mentioned at the beginning, it is intricate and there's a lot of moving parts. But what we've been able to do, because we're a high performing community across in the country, we have that flexibility from the federal government to make decisions based on the landscape in our community. And David has really been the champion for that, saying, you all know what your communities needs. Here's the money. Let's figure out the best way to spend it.
Gotcha. Well, thank you, Chris. And thank you, David, for fleshing that out a little bit for us. A question, again, has come from our audience, and maybe I'll pose it to you, Adam, which is the issue of evictions. And obviously, over the last couple of years, how has that affected our area?
Yeah, it's actually a very interesting subject. There was a great delay because of the moratorium on certain types of evictions, on most evictions, that went through much of the early pandemic period of time. But then the moratorium ended, and all of a sudden it was back to business as usual. And a lot of landlords have been sort of waiting to do their evictions, and all of a sudden there's a lot of evictions happening all at once. And I would actually be curious. I would pose it to Chris and Lorraine about what they saw on their end. But certainly for us, it seems like there was an influx of evictions happening sort of all at once. And one of the challenges of the United CT program, although overall I'd say it was a very good and important program, was that some families believed that they no longer needed to pay rent. There was a moratorium on evictions. There was money being given out freely by the state. And I will say that some tenants learned the wrong lesson, which was, I can't get evicted, so I'm not going to pay my rent. And then when it comes time, when it does come due, United CT let a lot of folks off the hook, and some of those folks then continued to not pay their rents, which was a challenge. So I would actually turn to Chris and Lorraine. And did you guys see on your end a recent influx in evictions impacting the system? Would be my curious.
What are you seeing, Lorraine, in your work?
In my work, we've seen that not a lot of evictions, because there has been a lot of resources put in place to kind of prevent that. So there has been, a lot of our clients has utilized the Unite CT and different pockets of funding that has been there to kind of help and mitigate. And also we have put in resources and service to kind of help folks to access those resources to prevent that evictions from going through. Chris, do you have any
Yeah, and I think it was mentioned that the communication, I think, was misunderstood. And what that people, when you kind of get half of the message going out. Oh, sorry, I'm seeing my screen kind of going back and forth. I apologize. I'm not sure what that's about, but the audio seems to still be there. But yeah, it was a lot of miscommunication, and the program was good and helped a lot of families. But in my, and I'll be honest, I kind of misread how I think things were going to happen. I thought with COVID and then the economy with the downturn, this wave was going to happen about a year ago, and I was wrong. But now we're starting to see that. I think we're starting to see with the lack of units, the amount of rents going up, and kind of the miscommunication in what resources are available. I think that's why we're starting to see the numbers go up. And I would mention one other thing is that the work that we're doing is so important, because when the times are good, our numbers look good, but our numbers need to go up when the times are bad. And I think that that's kind of part of the meeting we had yesterday is your diversion rates, meaning you can't have families entering the system when the landscape is this bad. Is it really getting? It's really getting bad. Sorry.
That's all right. That's all right. Technology, right? Let me ask a question to the group, and this came again from our audience. And a lot of good work, and it's been articulated, happening in this community, coordination, given the challenge of lack of housing, affordability, all those issues. But a question came in for the audience: are Norwalk's neighboring communities also engaged in this issue of addressing affordable housing? Who wants to jump in on that one?
If no one else will speak, I will start. I will say, look, I will say that some communities are doing some good work, often perhaps under pressure from the 8-30G legislation that requires a certain percentage of affordable units. I always want to point to Westport. It's one of the few suburban communities to have a homeless shelter, and I give them credit, absolutely give them credit for that. Are our suburban neighbors doing enough? And the answer is absolutely not. There's not enough affordable housing development going on in our suburban communities. And that could take some pressure off the system if they were to do more. And so I'd always strongly encourage anyone who lives outside of Norwalk to advocate within their own town, to be a part of the solution, and to put some resources, some real resources, into affordable housing in their own communities.
And we could have a whole hour conversation or longer on this, but I absolutely agree with Adam. We have gated communities, and there's no way around that, and it excludes those that are not extremely wealthy, and the data shows for it, and we cloak this in that local community control and character. But those that are in there extremely wealthy, when they limit the amount or the type of housing and the density, what they are in fact doing is ensuring that it is only the very wealthy that can live there. They might not state that explicitly, and they might say it's because of the character of the communities, whatever. They have fundamentally put the gates around their community and then said no to anyone who is not extremely wealthy. That's inexcusable in this state, and we have to. That has to be addressed and named. Now it gets to tactics. How do you do that? I mean, I'm more like a bull in a china shop. I just want to ram those gates apart. That often doesn't work very well. And so a lot of the work here is how do you change the narrative and work with communities to say this is narrow self-interest, their own personal interest. Having more diversity really supports the local character. It exports the economy, the schools, there's so many positives, and it's not seen as a threat, and not these outsiders coming in. It's folks that work in these communities that can't afford to live there, and that's a long-term game. But so I think we got to do it from all sides. We got to attack it hard. We got to lobby. But we also got to have those long-term conversations with communities.
Yeah, and I think, just for all, when we put this conversation together and we noted homelessness in our community, we were very intentional by not saying in Norwalk, because what constitutes community is really, I think, David, what you're referring to, and are we really talking about not just Norwalk, but a much larger community that needs to be part of the solution. So.
And I just want to add to that is that when we look at homelessness, we have to look at it through a racial equity lens. And the numbers are there that there's an overrepresentation of people of color in the homelessness system. So we have to look at who's in the room, who has a seat at the table, who's the decision makers, and why aren't there certain people in the room? Because we cannot end homelessness without addressing systemic racism. That's just the cusp of it. And so we have to build connections to improve outreach and services to the unsheltered BIPOC population, have like culturally specific models for services for that population, and having staff that are culturally competent and understand and respects different cultures in order to definitely make progress in that area.
That's
Well
great.
said, Lorraine. Well said.
Lorraine, it occurs to me that you just got back from a national conference to end homelessness. And I'm just curious, were there any particular insights or maybe just reinforcements that came out of your time at that conference?
Absolutely. So there were experts in the field that were there that address homelessness in their cities, their counties, and well as their states. And it goes back to what I just stated in regards to the lens that we're looking at homelessness. I think folks are looking at, really providing services strategically, and having intentionality with services that we're providing to different pockets of people, and also elevating the voice of those with lived experience. I think that's one of the things that they really spoke about, having a shared power, not having those that with lived experience at the table just as a token, but really giving them a seat that they can have really decision makers and powers, and also compensating them for their time at the table, and also talking about looking at the homelessness system from further up the stream. So a lot of the services and supports that we spoke about today is when folks are already entered into the homelessness system, but looking at it at, like I said, further up the stream, where what are services and supports that are in place to prevent folks from even entering the homelessness system. So I think that was a lot of the focus of some of the workshops that I attended. And I think it was very informative, and people around the country are really looking at like interventions and preventions to prevent folks initially from coming into the homelessness response system.
Yeah, great. Well, thank you. Thank you, Lorraine. I'm looking at our time, and we just have a few minutes before we wrap up. So I'm gonna ask each of you to comment, and keeping it kind of tight because we're literally down to a few minutes. And I think this question, in large part, you have already answered, but oftentimes the question is, how can we, meaning as a community, help to address this challenge of homelessness? So what can our communities, our individuals do to help address this issue? And let's start, Chris, let's start with you, and let's keep it tight so you all have a chance to respond.
So I really think what we need to do is making sure that our community partners, whether the municipalities, state representatives, are really advocating for the homeless services system. I know David and Lorraine were out in Oakland, in California, and those cities on the West Coast, from Seattle to San Francisco, Los Angeles, San Diego, those communities have serious challenges with the homeless population. If we don't do a better job doing that, we could have those same challenges here. And I think people don't think it will happen because they've traveled out there and oh, there goes my camera. They see it, And they don't think it can happen here, but it certainly can happen here if we don't address the challenges that we have.
Terrific. Thank you, Chris. Adam.
In order to go in a slightly different direction, I'm just going to say that in some regards, anti-poverty is anti-homelessness. So I would say not only are we advocating specifically for homelessness dollars, not only are we advocating locally wherever our locality is, whether it be Norwalk or New Canaan, Darien, or Ridgefield, but also advocating for a much higher minimum wage. I think we could do a lot to fight homelessness if people could earn a living wage. It's something that you can't do anymore without some sort of a college degree, it seems, or a household with two earners. So raising the minimum wage, making corporations responsible to actually pay a living wage to their employees and provide benefits, I think that could go a long way.
Terrific. And Lorraine, what can the community do?
I think part of what the community can do is team together with our community partners, pull together our resources. What do we all have to offer that we can help mitigate this issue that's happening in our community? And really, really addressing what we're seeing is why are pockets of communities just not willing to have certain affordable housing within their community, and what we as community people who are living in those areas can do to help drive that so that we can have those affordable housing come to our community, legislation, or our local folks that have some seat at certain tables to kind of advocate for that. I think that would be important.
Great. And David, final comments.
I'd keep on that advocacy train. I think an organization like FCA and multiple ones throughout the state have done a phenomenal job in working with your local constituents and funders. And you've upheld your part of the bargain. The federal government certainly has upheld its bargain, giving substantial money for homelessness and housing. The third leg of the stool is really non-existent. The state has not been at the table. It has not supported our system. So advocacy. Shame on the state. Shame on this governor for not supporting the homeless. Not a nickel, not a dime in his first 5 years.
Well, listen, I can't thank you all enough, David, Adam, Chris, Lorraine, for a really engaging conversation. And you gave some wonderful answers, and you didn't hold back on the answers, which I think is always helpful for people who are tuning in. So thank you all so very much. And we will pick up again on this topic at some point down the road. A reminder again to our audience, these virtual conversations happen periodically at FCA. We are looking to do another one late in the spring, so stay tuned. And I want to thank all of you for your time and attention, and especially for our terrific panelists. Thank you so very much. Take care now.